Hello, my name is Jonathan Miller, and I am a liver transplant coordinator with UCSF Medical Center in San Francisco. My current role is I am the inpatient coordinator, meaning that I facilitate the transplant process for patients who are currently admitted to the hospital, both before and after transplant. In my role, I see the mental health crisis in America coming out a lot in our patients who arrive with a history of alcohol use disorder or previous drug use that has led to their end-stage liver disease. A lot of times these patients have a long-standing history of depression, trauma, a lot of mental health related factors affecting their ability to make good decisions about their lives. And so one of the things that we see is a lot of patients will come and they need certain treatment to really address their addiction issues. And so addiction is a very serious disease. It is something that is made up of long-standing periods of sobriety, followed by relapse, followed by sobriety, etc. And many times we think our patients would really benefit from being able to get good mental health support, whether that be a one-on-one therapist or attending an intensive outpatient program or even an inpatient program where they could really focus on their sobriety and focus on the things that are contributing to their alcohol use, and so that they could really learn good coping skills. Unfortunately, a lot of our patients are very limited by their insurance coverage. They're limited by their financial means. And so they don't have that opportunity to attend a lot of those programs. And so we may want to make a recommendation saying that, hey, we would really like this patient to go to some sort of therapy, when the best that they can possibly do is maybe go to AA or some type of other community sober support, but not necessarily one-on-one work with some sort of therapist or even group work in some ways. So we definitely see that limitation. In addition to that, because of some of the reimbursements I think we see, we don't have a whole heck of a lot of programs here in the city that our patients can go to. There are some, but it is very limited. And the other things that we see is a lot of times these patients maybe would benefit from some sort of inpatient rehabilitation, but because of their mental health issues, because of their addictions, they end up with severe loss of their significant psychosocial support, meaning they don't have family and friends who are still available to be a support to them. Maybe sometimes they don't have a stable housing and they don't have a place where they can live. And so that becomes a problem long term. And it makes it very difficult for patients to overcome those barriers to get to transplant.